Hey America, did you know you can actually challenge your medical bills? Shocking, right? Most people don't. It's like finding out your pants have a secret snack pocket. Delicious, but also, why didn't anyone tell us? We're constantly bombarded with news about confusing insurance plans, surprise medical bills, and crippling medical debt. It's enough to make you want to stay home and self-medicate with essential oils and hope for the best. But here's a glimmer of hope. You have more power than you think. Yes, navigating the healthcare system can feel like trying to decipher ancient hieroglyphics while blindfolded. But knowing you can challenge unfair denials is the first step towards taking control of your health and your finances. So buckle up, Buttercup, because we're about to unravel this bureaucratic nightmare together. Let's be honest, the American healthcare system is a labyrinth designed by a committee of insurance companies, pharmaceutical giants, and confused pigeons. It's no wonder most of us end up lost and confused. Insurance plans are riddled with jargon like deductibles, copays, and out-of-network coverage. It's enough to make your head spin faster than a hamster on a wheel. And who has the time or energy to decipher all this complicated terminology? This lack of transparency creates a breeding ground for unfair denials and surprise bills. We receive medical care, often in emergency situations, only to be slapped with a bill that makes our wallets cry. And because the system is so convoluted, many Americans simply assume they have no choice but to pay up. But here's the truth. You don't have to be a medical billing expert to fight back. You just need to know your rights. And trust me, you have more than you think. Buried deep within the Affordable Care Act, like a delicious truffle in a dumpster fire, lies a powerful tool, the right to appeal. This little-known provision allows you to challenge insurance denials and fight for the coverage you deserve. Think of it as a legal Hail Mary pass, except instead of a football, you're throwing a stack of medical bills and a strongly worded letter. And the best part, you don't need a fancy lawyer or a law degree to do it. Appealing a denial can be as simple as contacting your insurance company and explaining why you believe the claim should be covered. You can provide additional documentation like medical records or letters from your doctor to support your case. It might seem intimidating at first, but remember, you have nothing to lose by trying. And the potential rewards are enormous: reduced bills, reversed denials, and the sweet satisfaction of sticking it to the insurance man. Unequal access. Not everyone knows their rights. While the right to appeal is a powerful tool, not everyone has equal access to this information or the resources to navigate the process. Many people are unaware that they even have the right to challenge a medical bill or an insurance decision. This lack of awareness can lead to significant financial strain and stress. And surprise, surprise, it's often the most vulnerable populations who are left behind. Elderly patients, for example, may struggle with the complexity of the paperwork and the bureaucratic language used in medical documents. They might not have anyone to help them understand their rights or assist them in the appeal process. Younger adults, for instance, are less likely to challenge medical bills, perhaps because they're new to the insurance game and don't know any better. They might not realize that they can question a bill or seek a second opinion. This lack of knowledge can lead to them paying more than they should or avoiding necessary medical care due to cost concerns. It's like when you first start playing Monopoly and think you have to pay rent even when you land on free parking. The rules are there, but if you don't know them, you can't use them to your advantage. This analogy highlights how crucial it is to understand the rules of the healthcare system to avoid unnecessary expenses. Similarly, language barriers and cultural differences can prevent non-native English speakers from understanding their rights or effectively advocating for themselves. They might not be aware of translation services or how to request them, leading to misunderstandings and miscommunications that can have serious health consequences. Imagine trying to win a game of charades when you don't speak the language. It's not just about knowing the rules, it's about being able to communicate effectively. Without this ability, non-native speakers are at a significant disadvantage in navigating the healthcare system. It's not just frustrating, it's downright unfair. The system is set up in a way that inherently disadvantages those who are already vulnerable, creating a cycle of inequality that is hard to break. This disparity in access to information only exacerbates existing health inequities and perpetuates a system where your zip code can be more determinative of your health outcomes than your genetic code. People in low-income neighborhoods often have less access to quality healthcare and information, making it even harder for them to advocate for themselves. And that's a bitter pill to swallow. The healthcare system should be a source of support and care, not a maze of confusion and frustration. It's crucial that we work towards a more equitable system where everyone knows their rights and has the resources to exercise them. The high cost of waiting when bills hurt your health. Here's a sobering thought. Fear of medical debt is so pervasive that it prevents many Americans from seeking necessary medical care. That's right, we're literally putting our health on hold because we're terrified of the financial consequences. Think about that for a second. We're so afraid of bills that we'd rather ignore a persistent cough, a suspicious lump, or a throbbing pain than risk bankrupting ourselves and our families. Delaying or avoiding medical care might seem like a solution in the short term, but it often leads to more serious health problems down the line. And guess what? More serious health problems usually mean more expensive medical bills. It's a vicious cycle of debt and despair, and it's not just individuals who suffer the consequences. When people delay care, their conditions often worsen, leading to more costly emergency room visits and hospitalizations. This, in turn, drives up healthcare costs for everyone. Drowning in debt. Medical bills are crushing us. It's a harsh reality that many Americans face every day. Let's talk about the elephant in the room: medical debt. It's a topic that often gets swept under the rug, but it's time we bring it to the forefront. It's a uniquely American problem, like reality TV and deep-fried butter, but unlike those, medical debt isn't something we can laugh off or ignore, and just like those things, it's excessive, unhealthy, and frankly, a little embarrassing. It's a burden that weighs heavily on millions of families. Millions of Americans are drowning in medical debt, even those with health insurance. It's a pervasive issue that doesn't discriminate. We're talking about hard-working people who did everything right. They got a job, paid their premiums, and yet one unexpected illness or accident was all it took to push them over the financial edge. It's a precarious situation that can happen to anyone. Medical debt can have devastating repercussions. It doesn't just affect your wallet, it affects your entire life. It can damage your credit score, make it difficult to secure loans, and even lead to wage garnishment. The financial strain can be overwhelming. It can force families to deplete their savings, sell their homes, and even declare bankruptcy. The emotional toll is just as severe as the financial one. This isn't just a personal tragedy, it's a national crisis. The ripple effects of medical debt are felt throughout our society. Medical debt places a significant strain on our economy, hindering growth and exacerbating income inequality. It's a barrier to financial stability and prosperity for many, and yet we seem content to let this problem fester like an untreated wound. It's time for a change, for a solution that addresses the root of the issue. We need to advocate for better healthcare policies, for systems that don't leave people in financial ruin. It's a fight we must all take part in. Together we can push for reforms that ensure healthcare is a right, not a privilege. Let's work towards a future where medical bills no longer crush us. A better way forward, demanding transparency and fairness. Okay, so we've established that the American healthcare system is a bit of a mess. From confusing bills to unexpected charges, it's no wonder patients feel overwhelmed and frustrated. But it's not all doom and gloom. There are countless dedicated healthcare professionals working tirelessly to provide the best care possible. We can fix this, America. It starts with us coming together as a community, raising our voices and demanding the changes we need. But it's going to require some serious changes and a collective demand for transparency, fairness, and common sense. We need to hold the system accountable. Firstly, we need to simplify medical billing and make it easier for patients to understand their rights and responsibilities. Clear, concise, and straightforward bills should be the norm, not the exception. Let's ditch the confusing jargon and create a system that's as user-friendly as ordering takeout on your phone. Imagine being able to see exactly what you're being charged for in plain language. Secondly, we need to empower patients with the tools and resources to effectively navigate the system. This includes easy access to medical records, transparent pricing, and support from knowledgeable advisors. This means providing free or low-cost assistance with appealing denials, negotiating bills, and understanding complex medical terminology. No one should have to face these challenges alone. And finally, we need to address the root causes of high healthcare costs, like inflated drug prices, administrative inefficiencies, and a lack of price transparency. These issues drive up costs for everyone. This isn't a partisan issue, it's a human issue. Regardless of political affiliation, we all deserve a fair and transparent healthcare system. We all deserve a healthcare system that prioritizes our well-being, not the bottom line of insurance companies and pharmaceutical giants. It's about putting people over profits. It's time to demand better, America. We need to stand up and make our voices heard. Our health, our wallets, and our sanity depend on it. Together, we can create a system that works for everyone, ensuring that healthcare is a right, not a privilege.